Good afternoon. The news today with the epidemic is mixed. Case counts continue to rise nationally and in Pennsylvania as a whole. Here in Philadelphia, our daily case counts over the past week have been stable. So here are the numbers. Since this time yesterday, we've identified 157 new cases of the coronavirus in Philadelphia residents, bringing us a total of 28,024 since the beginning of the epidemic. Now, those cases were distributed over the past few days. If you look at the last week, ending last Saturday, we're averaging about 110 cases per day. And we're averaging about 5 to 6% of those who were tested testing positive. Now, I will point out that we are having delays in reporting a positive test result to the health department. I'm getting concerned that delays in the reporting may make it harder for us to be able to track our data trends. They maybe influence our data trends. And so in the future, I'll let you know if I feel like those trends may be giving us a false sense of numbers decreasing, when in fact it may just be reporting delay. Of those cases that are reported to us, we're still seeing a predominance of younger people. For today's new cases that we're reporting, 32% were under the age of 30 and 58% were under the age of 40. For comparison, for the epidemic as a whole, 21% are under the age of 30 and 39% under the age of 40. So substantial shift towards people in the young adult years. Since this time yesterday, we've identified 18 new deaths from the coronavirus, bringing us to a total of 1,664 since the beginning of the epidemic. Now, that larger number today was a result of a match with death certificates, which we do about once a week, and identified deaths that have occurred in the past, generally over the past 2 weeks. We're running between 1 to 2 deaths per day in the past 2 weeks, which is far lower than we were before, but that's now fairly stable. Of those total deaths, 863 or 51% are nursing home residents, and that is pretty stable where we were before. A little bit more on testing. A couple days ago, I gave you a breakdown of the race of people who've been tested across the city. There's more data on the demographics of those tested, both positive and negative, that's now on our website, and that'll be updated on a regular basis. As I mentioned earlier, we're still seeing long delays, 7 days or more, for the reporting out of positive results from 2 large out-of-state laboratories. That's LabCorp and Quest, 7 days or more. Now, these 2 labs do about 1/4 of the tests that are done on Philadelphia residents. And the reason is that those labs have become overloaded with a very large demand from other parts of the country where they're seeing surges in the epidemic. So we're working to see if we can redirect those tests that are collected in Philadelphia to other laboratories that don't have such a bottleneck. But I want to reiterate the message I made a couple days ago to those people who are tested in Philadelphia. You should stay isolated until you get your test results, and it may be 7 days or more until you get your test results. I understand that's very inconvenient, but it's simply that's where we are right now, and until you get your test result, you don't know whether you're going to be positive or negative. More information about the different sites where you can get tested, again, is www.phila.gov/testing. Now on social distancing, yesterday we held a press conference where the Philadelphia School District announced their reopening plan. That reopening plan included reducing the number of children in school in any given day by having children go to school only 2 days a week. Some would go Monday, Wednesday, the others would go Tuesday, Thursday. That would reduce by half the number of children who are in the school at any given day. And that greatly reduces the crowds and provides more opportunities for social distancing. There are many other safety steps that are built into the plan. As I said yesterday, there's no way that we can reduce the risk of this infection in schools to zero, but we do think that this plan minimizes that risk. Now, that is the plan for the Philadelphia public schools. We know that there are other schools in Philadelphia, and there's guidance for all schools to follow on the website. There's one guidance for elementary schools, and there's another guidance for middle and high schools. And that's for schools, but there's also colleges and universities that are not too far off, maybe opening up for the fall semester. But the ages of people who go to colleges and universities, there are particular reasons to be concerned there. These are the ages where we're seeing the greatest increase in the epidemic right now. So we've asked those colleges and universities to give us their reopening plans, and we're reviewing those plans right now to see how we can minimize the risk at those institutions. Now, yesterday, the governor announced additional social distancing mitigation steps for the state as a whole. Most important, from my perspective, he's closing bars, and he's restricting restaurants that have indoor dining to less than 25% of their total capacity. He's also restricting indoor events to fewer than 25 people. With these changes, this brings the rest of Pennsylvania much closer to the policies that we've had over the past few weeks already in Philadelphia. So I strongly support those actions. I think that's the right thing for the governor to do. The one area where it's different is here in Philadelphia. We are not allowing indoor dining at all. Across the rest of the state, indoor dining is allowed, but with a much restricted capacity. And I think that consistency overall is good. It makes it easier for people to comply when there's the same rules at the city level and at the state level. And the governor did allow gyms and fitness centers to stay open under some strict safety standards. It required masks use at all times, 6-foot distance between people participating in the gyms. And he recommended that people exercise outdoors as much as possible rather than indoors in the gyms. So after consideration here in Philadelphia, we will be allowing gyms and fitness centers to reopen effective Monday with similar safety requirements, very strict safety requirements. Masks will be required at all times. 6-foot distance will be required at all times. Exercise classes will have to be fewer than 10 people in addition to the distancing requirement. And there are other guidance, other standards will be on guidance that we're going to be posting on our website. And likewise, we're encouraging people to exercise outdoors whenever they can. Now, let me just note that many people find it difficult to do vigorous exercise while wearing a mask. And if so, then we recommend that you avoid gyms because the masks will be required in the gyms. Maybe that the gyms will be used primarily for weightlifting, not for aerobic exercise. Now, we want to be certain that gyms are following these safety standards so we don't have risk at these facilities. So the Department of Public Health, hold on one second. The Department of Public Health has not required permits of or inspected gyms in the past, but we are going to be enforcing strictly. So we will be doing inspections at this point. We'll be doing inspections proactively, unannounced, as well as in response to complaints. So unannounced and unscheduled. We will just have our inspectors show up at gyms, and they're going to see whether people are wearing masks, and people are keeping the appropriate distance, and if they're in compliance with their other standards. So I'm going to be putting gyms on notice, both here today with this information and in a letter that we'll be sending to gyms about this, and making it clear that if people are not wearing masks when our inspectors go in there, we will be closing those facilities. And if we have cases of the coronavirus infection that are linked to gyms, we will close facilities. And if the epidemic surges, we may require the entire sector for gyms to close as part of a larger shutdown. That possibility still exists, especially with the epidemic trending in the wrong direction right now. So any gyms that are opening with this opportunity have to be aware that they may open and then in a few weeks have to turn around and shut again. But we want to give people the opportunity to have that exercise, which is good for health, if they follow these very strict safety standards. Then let me remind everyone of the safety precautions. Masks are so important right now. We need to have an increasing percentage of people in Philadelphia using masks. So we do have our mask media campaign, which is out there. You've seen it on buses elsewhere around the city. Much is up so far. There's more to come. We're also distributing flyers and posters to more businesses across the city. We'll continue to do that. So the businesses will be giving you a reminder that you need to wear a mask. And it's also a reminder to the businesses that that's part of their responsibility to require anyone in retail stores to be wearing masks. Distancing is important, likewise, as part of the recommendations, and reducing crowds. Just remind people as well that anybody who can continue to work from home should do so. So we have fewer people in general going around and have fewer people at the work site. And we're recommending that people avoid social events. We do know that social events are taking place, but we especially think that these social events are contributing to the spread among young adults, and that's what's driving the epidemic right now. So that's where we are today. More information on all of the epidemic, visit our website, www.phila.gov/COVID.
Hey, good afternoon. Dr. Farley, with a 7-day lag, do you have enough up-to-date information to accurately gauge the infection right now?
Well, I am concerned about that. Now, that 7-day lag is not for all of our tests. It's for 1/4 of the tests. So we do have some picture of what's going on, but it is possible that our view of what's happened in the past few days is somewhat thrown off by just that delay.
What is the impact of that? What does that mean for your ability to react to this pandemic as the public health official and leader of the city?
Well, we have multiple sources of information. Certainly, this is a key one. We would prefer to have it be better than it was, but it does make it potentially makes it that we're a few days delayed in knowing what's happening, make it slower for us to have the response. We're going to be looking at our other sources of information as well to try to minimize the risk of that. I'm more concerned, frankly, though, on the impact on individual people who are going to get a test and won't get the result for 7 days. And then, of course, contact tracing isn't of much value if the positive result doesn't come out for 7 days. So again, this is a national problem, not just a Philadelphia problem. We're going to do what we can about it, but at least want to let people know that this exists and that they have to address it in the short term.
You said on Tuesday that fewer than 200,000 total Philadelphians had been tested at all since the start of the pandemic. I'm curious, that's less than 15% of the city's overall population. Is your scale of testing even approaching a large enough sample size for you to have an idea of where we're at? And now you toss delays on that. I'm just wondering if you have the kind of information and the scale of information that you're going to need in order to put out fires when they pop up.
Yeah, so I said before that we do want to increase our testing, and my goal is ultimately be at 5,000 tests per day. There's a number of reasons why we're not there yet, but I think it's not appropriate to take that number divided by the whole population because people's status can change all the time. And so even if we tested all 1.5 million people today, that wouldn't tell us what's going to happen tomorrow. So it's more, we want to know that if people have symptoms, that they can be identified right away, and that we are testing enough people to get a sense for where the epidemic is going overall. We do think that most people can get access to testing now. We have 55 test sites across the city. We have a pretty good sense of where the epidemic is because we can also look at the percent positive in addition to the number positive. So we're in a much better position now than we were in March when we started out and we were doing virtually no testing. We want to do more, but it's not as big a problem as you would suggest.
Están preocupados están ellos. The questions have to do with COVID and also with the encampment. And the question has to deal, given that the governor is concerned about an increase in cases, how worried is the city about letting the encampment remain, given that it represents a danger for public safety?
So Armando, I'm having a little trouble hearing your audio, but I think that the question was, am I worried about COVID at the encampment? I'm certainly worried about COVID in any crowd of people outdoors or indoors. Outdoors is probably less a risk than indoors, but it's still a risk. And so, yes, we would definitely not want to have the encampment there. And I know that other city leaders have been working hard to try to resolve that situation.
Hi, this question is for Dr. Farley. We just wanted to get your reaction, Dr. Farley, to the policy lab at CHOP forecasting a COVID-19 resurgence in the Philadelphia area. You've heard of that?
Yeah, I'm aware of the models that the policy lab has done. And I'd say what they've done is just put a little more mathematics behind the same concern that we've had for some time now. That we're seeing increases in cases around the country. We're seeing increases in cases around the rest of Pennsylvania. And so that definitely puts us at a greater risk for an increase in cases here. That's why we did not allow restaurants to open up with indoor dining, for example, a few weeks ago. And so that they have a model that is similar to that. All models are just an attempt to try to predict the future. You can't totally predict the future, but it says that there's reason to be concerned, and we are concerned.
Yeah, and just in reference to the gyms and fitness centers being open on Monday, what's your biggest concern? I know you said you're going to do kind of pop-up inspections in a sense, but what would it take when you say that you may ultimately have to shut some of these centers down if they're not following policy? I mean, if you see spikes in coronavirus cases, or what are you looking for?
Yeah, our biggest concern around the gyms is that when people are doing vigorous aerobic exercise, it's very uncomfortable to wear a mask. And so the gym users are not going to want to wear masks. And the gym owners may not want to enforce that. We think if they do enforce that, that they can operate in a safe way. But we're really putting the onus on the gym managers to do that enforcement, and then we're going to inspect and make sure that that takes place. If we inspect and we find out that they're not wearing masks, then we're going to say this opportunity is failing, and so that gym cannot be open. Or if we see cases occurring where someone got infected, and from our contact tracing, we believe they got infected in the gym, likewise, we would shut that down. So it's an attempt to meet the interest in exercise, which is good for health, while also being very careful about infection control in the process. And so I want to also reiterate what I said before. For those many people who find it difficult to do vigorous exercise without a mask, don't go to gym then, because you're not going to be allowed to run on the treadmill and not wear your mask.
Hi, this is in reference to athletics, interscholastic. The PIAA is going to move forward with fall sports. And I guess they're looking for guidance from the governor or maybe you guys. Is there any chance that the city will step in and provide any kind of guidance for interscholastic athletics?
So we have guidance right now on our website about outdoor sports and exercise that includes some pretty strict limits on how that exercise is done and a prohibition on spectators. And so that guidance is in effect right now. The epidemic could change, that guidance could change in the future. But in the city of Philadelphia, they need to follow that guidance.
But so right now, there's no reason for the city to step in and prohibit that.
Well, that guidance has prohibitions in its own right. And so I'm not quite sure what
I'm just saying football and fall sports can proceed in the city as far as you're concerned.
No, not necessarily. Read that guidance carefully because there's some real limits on what they can do. And again, I'm not sure what they're planning on doing, but having.
Can they play games?
I have to refresh my memory on it, and I think we're certainly discouraged playing competitive games between two teams. I don't know if it actually prohibits that. It certainly prohibits spectators, and it limits the number of people who are involved. So I'm going to have to refresh my memory myself, but you can do it as well. So there are some pretty strict limits on it. I believe that what the PIAA may feel is okay is not in keeping with that guidance.
So would you then be the one who could enforce that, or would that have to come from the governor?
No, the city of Philadelphia can be more restrictive than the state as a whole. And so they have to follow the order in the city of Philadelphia for, if they're playing in Philadelphia.
Right. Thank you.
So can we expect the same adherence you have with the gyms to places of worship, to any place that has an outbreak? And there was a report given that masks were not on.
It's tougher in places of worship. There's a real First Amendment right there, and I think that it's going to be tougher for us to shut down a place of worship. We certainly want everyone to follow our standards wherever that takes place. We certainly will be, if we find evidence of spread in one of those facilities, we'll be talking to the facility manager about safety guidelines. But we are not, may not be regulating in the same way that we're regulating gyms.
Would the same thing be applicable to schools?
To
schools? Would the same thing be applicable to schools?
Well,
where there's an outbreak, where a teacher gets it, 3 or 4 students get it, and...
Yeah, we are looking now, what would our criteria be for shutting an individual classroom or a school or the entire school system? Any of those may take place if we're finding evidence of spread. It really depends on how much spread we're talking about.
Okay, and last question is, I know New York has instituted, if you come to New York and you're from Florida, you need to fill out some paperwork. Will Philadelphia be instituting something similar?
Yeah, I don't think there's any practical way for us to put requirements on people traveling in and out of the city. There's just so many ways to travel in and out. We don't have, borders and border guards here. We do have our recommendations that when people travel from a high incidence area, that includes Florida, that they quarantine for 14 days. It's something we don't really have the mechanism to enforce, and so we're simply asking people to do that. Just practically, there's no other way to have to be stronger.
This is for Dr. Farley. Is the city keeping track of positive COVID cases at the Parkway encampment or the encampment on PHA property in North Philly?
I don't know that we have any way of tracking whether they were at that encampment. That's not information that's collected when someone goes to a test site.
Yep. But I will say we are aware of some individuals who have been at the encampment that have tested positive, but we don't know if they are still at that location.
Dr. Farley, just a quick question on one other disparity that I noticed, or that some restaurant owners were talking about between Governor Wolf's recent order and Philly's rules. As far as I know, so Governor Wolf's order said that anyone at outdoor dining areas must order food along with drinks. Like, they can't just sit out there and get drinks. And I thought that Philadelphia's requirements were just that the place had to serve food as well as drinks, but not like for each individual customer. I've heard from some bar owners who are frustrated about the differences there. Am I correct in Philly's describing Philly's policy, or?
You may be. I had not recognized that there was that difference between the state and Philadelphia. I think what the governor wanted to do is basically close bars but allow restaurants to stay open. And so the way he defined it, because there's no legal difference between a bar and a restaurant in the state of Pennsylvania. That's the way he defined it. So whether it's appropriate for us to take action based upon alcohol consumption or food consumption, something for us to look into. I'm not also sure if we have the legal ability to do it. Now, I would say this, the governor's order applies in Philadelphia as well. We could be more restrictive, but not less restrictive. So his order ought to apply here as well. So we'll have to look into how that exactly does apply.
Okay, yeah, I mean, his release says, customers must order food if they're ordering drinks. So I guess that is the case now in Philly also.
No, this is just occurring to me right now, but it sounds like it. We'll look into it to be sure.
Okay, thank you.
Okay, this question is for Dr. Farley once again. My question is, since you have announced that gyms will be reopening in spite of the sweating that takes place in there and the saliva drops that may be spread when people are not properly wearing a mask, why open gyms and not open restaurants when there's going to be no sweating involved in there?
Yeah, a couple of things. First of all, the virus is not spread through sweat. The virus is spread through respiratory secretions, what comes out of your mouth. And we are opening gyms with very strict enforcement that they wear masks 100% of the time. That wearing of masks cannot take place in a restaurant where people are eating and drinking. And that is the fundamental difference there. That's why restaurants are more high-risk environments than gyms or other places.
Okay, and this last question is for Dr. Farley. The question going around our newsroom is the governor comes out yesterday, says we're reducing in restaurants to 25% because we're so concerned about an escalation. And now the city of Philadelphia says, but we're opening up gyms. And that's indoors, not necessarily the best ventilation. Just wondering how the city got around to that decision-making process on the heels of what the governor said yesterday.
Yeah, I can understand the question, but the real issue is what's the risk in the situation? And that risk is tied very strongly to whether people are wearing masks. And in gyms, we initially didn't open them because we were concerned that people would not wear masks, but we've come up with a mechanism to enforce that. And we hope we get very high levels of compliance. If we don't, then we'll be shutting gyms down. In restaurants, people cannot be wearing masks. I'm still far more worried about the restaurants that are open in the rest of the state at 25% capacity where nobody's wearing masks than I am about gyms where people are wearing masks.
Thank you.
Okay, thank you. We have time for one more question. We're going to go to Mike D'Onofrio of the Tribune.
This is a quick one. Mayor, I just wanted to double check on this. Did you say you'll be meeting with organizers for both encampments, the one on the Parkway and the PHA property one, or are you letting the PHA? Yeah.
My understanding is it's a delegation of people, which I believe are from both of the encampments, and that's my understanding. Unless I've been informed differently. And by the way, I want to apologize for using goddamn good job. I should have used just damn good job. So anybody that's offended by the use of the word God, I apologize.
Mike, the meeting will entail both camps, representative from both.
Okay, that's all I got. Thanks.
Okay, thank you all. That concludes our briefing today. We will be back next Tuesday at 1 p.m. Thank you.
Thanks.
Thank you.
Yeah.